Hello, everyone. It's great to talk to you today. So my name is Tim Zecchin. I've worked in media analytics for the last 15 years, primarily in helping NGOs better understand citizens through social media data so that we can communicate more effectively with them. So today, what I wanted to do was to share with you 5 key areas that we see our partners focus on, and some of the opportunities and the challenges behind some of those standard approaches. So first of all, probably the most commonly discussed and asked topic that we get asked is around measuring sentiment, particularly around information shared on topics like COVID-19. And lots of the social media listening tools out there will often look to primarily measure sentiment as to whether it is positive or negative. But the first challenge we always have with that is that it has varying and often low accuracy. So often not much better than the toss of a coin, and at best around 80%. So it's quite hard to make decisions based on that sentiment. Is often trained to be more relevant towards a corporate entity or a product or a service. And so it has quite weak relevance in public health emergencies, which gives us a challenge. It is useful in some places though. So below there is a WebMD post that was issued, I think last week. And we saw quite negative sentiment being posted alongside that post. So we took a greater look at those comments. And actually it was lots of users talking about how they found the post, which was looking at the comparison of symptoms between cold, flu, allergies and COVID-19. And it was quite confusing. The users were getting cross because they found it quite confusing. And so that was an interesting learning to us. But where we actually see more value in analysis of social media content is around looking at the emotions that citizens are expressing. So this provides us with more actionable insights to be able to respond more appropriately to the questions and queries or fears that they might be expressing. It also helps us measure the efficacy of public health messaging. So if we're able to, for example, reduce fear, and increase acceptance or bargaining around a particular area, then we know that that messaging is being more understood, and therefore we're reducing the susceptibility to share misinformation. And so you can see there in the chart below, these are some of the emotions that we're currently looking at around the COVID-19 outbreak. So this is in English language only. And we're measuring those emotions between denial, sadness, anxiety, fear, anger, and bargaining or acceptance. And here you can see people talking most frequently fearfully about symptoms. Another area that we get a lot of questions around is looking at using tools to identify good or bad, very specific information. And actually those specific posts of information have often been individually spread by the time that they are identified and challenged. We see that being more useful where content can be identified systematically, perhaps by an algorithm or by particular influential sources, and normally at platform level. So we heard, I think, from Facebook yesterday about how they're undertaking some of that task. But where we see it more interestingly used is where we're starting to see particular narratives emerge and develop. So it enables us to start to understand where misinformation might get a foothold in the coming days and weeks. Because once those narratives get a foothold with citizens, we see similar misinformation starting to be spread by multiple sources, and it has a longer lasting impact. And so by understanding that nuanced information, which is often harder to detect, and you can see here some examples all the way from the fake example that was tweeted from a UNICEF Cambodia post in the bottom left of the screen, through to a more nuanced piece of misinformation that was supposedly a text from an NHS worker in the UK, through to a narrative that we see playing out around the panic and the response to the disease perhaps being worse than the disease itself. The third area we often get asked about is measuring the volume of conversation. And we might argue that it's actually more useful and more valuable to look at the velocity in which a particular topic or message or set of information is being spoken about by citizens. So lots of people will look at volume because it's easy to measure, but it doesn't necessarily mean that everybody has been influenced by high volume of posts or content in social media. We see measurements like reach, like engagement or frequency to be much more relevant. And then the velocity in which the narrative or a piece of content becomes shared is much more meaningful. And that relative speed in which people are picking up and then sharing a narrative or a piece of information gives us a much greater indication of how that piece of information is likely to spread and how people are likely to react to it. So early detection becomes much more critical in these types of examples. And you can see here we've been looking at some posts in English language around children. And you can see that whilst the volume of the schooling debate and homeschooling was quite important in mid-March as schools were starting to be shut, you can also see in the bottom right of the trend chart how family suddenly started to peak a couple of weeks ago. And that was as those domestic abuse concerns were starting to come out. So by no means the highest volume of conversation, but actually in terms of importance and the velocity in which that conversation was taking place, far more interesting than the volume of school debate. The fourth area is often looking at key sources and whether or not they're sharing correct or incorrect information, so wrong or right. Challenging those sources is often quite a challenging process and quite resource intensive as well, to be able to detect individual pieces of incorrect information before they spread. Arguably, it's much more important to help educate citizens how to identify misinformation or what is likely to be misinformation, particularly in social media. But as that becomes more nuanced, it becomes more difficult, and it's also a risk to be stifling public debate. So a focus on sharing correct information and really focusing on doing that via trusted sources becomes far more important. You can see there's a bubble chart on the screen down in the bottom left-hand corner of the slide. And this is actually looking at the reasons that social media citizens were posting last summer in relation to why they weren't vaccinating their children. And you can see that the largest reason that was being quoted by citizens was a lack of trust in the medical system or government. So a lack of trust in the sources that were giving them this information. So by focusing on the correct information and using trusted sources to be able to share it is the key thing in being able to make sure that that information is acted upon and taken seriously. Lastly, we see a great focus on trying to identify those people that share and originate misinformation. But often, because they are just one source, and that can be quite a challenging task, that's often not a great use of the focus of time. It's often retrospective, so it's often looking at something once something's happened. And actually, and you can see this in the example chart below, what can be more interesting is to seek out those individuals that are likely to share misinformation once it's already been posted by the original few sources. So this is a chart that shows the spread of a tweet as it's been reposted. And you can see there circled the original Twitter account in green. And then you can see these three key sources circled in red who actually then amplified that tweet. And most of the amplification occurred within 5 hours of that original tweet. So it's a very, very fast process. And actually what we find much more valuable is identifying the sources or the citizens that are asking questions, because they start to give us the clues as to where misinformation is likely to try and fill information voids in the coming days and weeks. And that helps us actually meet that demand, as we heard from a talk yesterday where we talked about supply and demand. If trusted sources don't fill those information voids and try and predict what those citizens are likely to be asking, then the sources of misinformation often will. And we're able to understand as well in these audiences from social data where they are most commonly influenced. So whether it's from advertising campaigns, by social media, by different brands, by their friend and families, so that we can communicate with them more effectively. So if there's 5 takeaways that I'd ensure that you are all thinking about, I'd be thinking about emotions being more insightful than just plain sentiment, looking at emerging narratives rather than individual pieces of incorrect information. Don't just focus on the volumes of conversations, but look at the velocity or the virality of content. Make sure that you're focusing on measuring the correct information as a more important focus than the existing misinformation. And make sure that we are taking action, yes, on those sources that are sharing misinformation, but let's really focus on those emerging topics from citizens where they're asking questions, and that will help us beat misinformation tomorrow. So to try and sum all of that up, I thought about that old saying of prevention is better than cure. Let's try and quantify tomorrow's debate so that we can make sure that we're reducing that future susceptibility to misinformation. Thanks very much.